My name is Margaret Jurocko, and I want to thank you for having me participate in this survivorship panel today. I was the primary caregiver for my son, Jackson Taylor. But my journey as a caregiver started way before the transplant. After the birth of my first son, Alex, who's now 24, followed by Jackson, who's now 22, they have a rare genetic condition called X-Men. So unfortunately, they were put at risk of contracting many bacterial and viral infections and lymphoma. My son Jackson was diagnosed with lymphoma during his first week in high school as a senior. It was extremely difficult. 4 months after that lymphoma diagnosis, he was a bone marrow transplant, a recipient at the National Institute of Health on December 21st, 2016. Here's a picture of us receiving his life-saving stem cells from his donor, Sean. There he is. There's his dad on the left, myself in the middle with him, and his brother, Alex, on the right. Great photo. So I was Jackson's primary caregiver pre and post transplant. We were fortunate to have a very large support team of family and friends and an outstanding medical team surrounding us. But I'm doing this panel today because I feel strongly about advocating for the needs of caregivers. Sharing this personal experience as a caregiver is sometimes difficult to do because we rarely take the opportunity to talk about our needs or our anxieties because we're always so focused on the physical needs and mental well-being of our patients. I want to talk to you about the life post-transplant and the ways it impacted me, both physically and emotionally. You know, I'm not a doctor, and most caregivers in my position are not trained to take care of patients, but you need to kind of think like a medical professional. That's what I believe. There are so many potential complications that a patient can experience after transplant, but I believe if medical teams could expand on more of the common occurrences, it would have helped me be better prepared. You know, there's a wealth of information to absorb, and it's very difficult to remember it all when you're going through transplant, especially with a loved one. For example, Jackson experienced 45 days of side effects from a virus called BK virus. This virus, it increased his frequency of urination, his pain while urinating, and he had blood in his urine. And as a caregiver, I felt helpless. I tried to assist him when walking to the washrooms, helping nurses collect samples, and making sure his pain was managed appropriately. You know, this caused a little bit of uncomfortable situation between mother and son, but we persevered and we got through this challenge. It was one of the many obstacles that we would face on the path to his recovery. So on top of health incidences, I had regular day-to-day responsibilities of prescription medication scheduling, doctor's appointments, scheduling, household cleanliness and hygiene, as well as normal day-to-day home economics. You know, Jackson's 100th day celebration post-transplant milestone was celebrated with his brother, Alex, and our team in Bethesda. It was such a significant and very joyous occasion, but this did not mean Jackson could resume normal activity. We had many emotional challenges after this 100th day celebration. He was still in isolation for 3 more months at home. Today, the concept of isolation and distancing and mask wearing is all, commonplace. But in 2017, we didn't have the rest of the world participating alongside of us. So You know, as a caregiver for a 17-year-old high school student, I found myself coordinating extracurricular uh, tutoring for him, coordinating teacher communication, encouraging school participation. So these additional responsibilities were very significant for the well-being of Jackson because he wanted to graduate with his senior class. You know, as a mother, you do this with love in your heart, and this created extra anxiety to help him achieve his goals. He did successfully graduate with his class, but it wasn't easy because he was not able to attend college with his peers until 1 year later. We rarely left him alone because his loneliness and exclusion from not participating in university, it was a real emotional loss for Jackson. We felt heartbroken for him at times when he was on Instagram and Snapchat, experiencing life through virtual events. So the year after transplant, it's like a roller coaster. One experiences extreme gratefulness and happiness, and sometimes extreme sadness. And it's really important for caregivers to stay as positive as possible for your patient while you're simultaneously dealing with your own issues. Personally, I had my own challenges to overcome. I had to put my career on hold and to take care of my son for a full 2 years because my job required me to go into client homes and work with them physically. You know, the potential financial impact on families is so very significant. As a designated caregiver, will find it difficult to maintain employment while providing care. Families really need to make financial plans prior to transplant and a caregiver's needs. You know, even 2 years after Jackson's transplant, as a caregiver, I was a little less optimistic, a little less self-assured, and a little less confident when I went and returned back to the workforce. I attended pre and post-transplant therapy sessions with a remarkable psychiatrist. He was very supportive and gave me many practical tools to help me understand the magnitude of managing my son's transplant. He encouraged self-care, expressing both types of feelings, all kinds of feelings, and he gave me permission to forgive myself. I've always been the kind of person to love unconditionally, but it was kind of traumatic for me when I experienced disappointment and abandonment from the lack of sympathy and support from a few of my very close friends. I was not prepared for the loss of friendship. I did find comfort and solace in sharing with another caregiver. While Jackson was at the NIH, I met another caregiver, and we've remained friends for 5 years. Unfortunately, they lost their loved one before a transplant was done. But speaking with her and sharing past and present stories really brightens our days and gives us, both of our families, hope. I'm now proud that I'm a peer connect volunteer with Be the Match organization. It allows me to offer support to other caregivers that are experiencing similar challenges. I still consider myself my family's keeper. The journey that we've experienced and continue to travel has made us stronger and much closer. It has required intense focus and real sacrifice, but the outcome has definitely been worth it. My oldest son, Alex, will be graduating with his master's this December, and Jackson is a senior at college, and he'll be graduating in the spring with the honors of commerce degree. He loves playing golf. He's thriving. He loves working out, playing music, and hanging out with many of his friends. And here's a recent picture of Jackson and I had a night out for dinner this past summer. There we are there. And thank you for listening to my story.
Thank you, Margaret. That was absolutely moving. Both you and Suzanne have shared some really pertinent points with us that really add a layer that it's very, very hard for clinicians to understand. Even those, and most of whom in transplant, I would say, put so much energy into understanding the complexities that are being dealt with by our patients and those they love, their caregivers and their families. So thank you both. And thank all of our speakers for bringing forward a beautiful picture, if you will, of the complexities that are layered in to the recovery following a hematopoietic stem cell transplant.